Hello, my name is Taylor Watterson, and I'm excited to share findings regarding CancelRx, the role of technology when controlled substances are discontinued. Health information technology, or health IT, can help to streamline not only the prescribing of controlled substances through e-prescribing, but also the discontinuation of controlled substances. This is important because prescription opioid misuse is a serious national crisis. In 2018, the top medications involved in prescription overdose deaths were pain medications, the opioids, benzodiazepines, and stimulants. So when we talk about the opioid epidemic, it's important to look beyond just opioids, but more broadly at other controlled substances. Specifically, one contributor to opioid misuse is the unintended availability of prescription opioids and controlled substances. What does it mean for a prescription to be unintentionally available? Well, for example, a prescription that the prescriber intended to be discontinued or stopped, but the pharmacy isn't made aware, dispenses the prescription, and the patient receives the medication anyways. Even if the patient has no ill intent of using it themselves, it's still out there. Enter CancelRx. CancelRx is a health IT that automatically communicates medication discontinuations from clinics to pharmacies. It works behind the scenes to communicate that a prescriber has discontinued a medication and alert the pharmacy staff that the medicine should no longer be filled. Often used for more than just controlled substances, say a patient's blood pressure medicine, we wanted to know the implication of this health IT in controlled substances, since we know the important role they play in the opioid epidemic. To do this, we utilized prescription controlled substance discontinuation data from both clinics and pharmacies at a Midwestern academic health system, and we merged them together. Were prescriptions discontinued in the clinic also discontinued successfully in the pharmacy? We collected data for 12 months prior to CancelRx implementation and 12 months after, using an interrupted time series analysis to compare these success rates over time. Let's zoom in on our results. CancelRx went live at our Midwest health system in October of 2017. In the time leading up to its implementation, we see a slight increase over time in the proportion of successful discontinuations. This could have been due to a number of external factors, including heightened awareness of opioids and the opioid epidemic. In this period, a clinic staff member, likely a medical assistant, had to call the pharmacies to alert them of the discontinuation of a controlled substance and that it should not be filled. We see that prior to CancelRx, we've reached about a 24% rate of successful discontinuation. We can see after CancelRx implementation, there was an immediate and significant increase in the proportion of controlled substance medications successfully discontinued in both the clinic and pharmacies. A 78% increase and close to 100% success. Interestingly, we see that the success is sustained in the year following CancelRx implementation. So what does this tell us? CancelRx, this automation health IT worked, for one, but thinking beyond that, the primary purpose of this health IT is to ensure that pharmacies have up-to-date medication lists and to prevent the inappropriate dispensing of discontinued prescriptions. When medications are appropriately discontinued at the pharmacy, we're preventing their unintentional dispensing or availability. This is crucial, especially in controlled substances, and has implications for reducing harm related to the misuse, diversion, overdose, and death related to the opioid epidemic. Our study provides further evidence for the widespread adoption and use of CancelRx by physicians, health systems, and pharmacies. We'd like to take a moment to thank our numerous funders for the entire CancelRx portfolio, including the NCPDP Foundation. You can find a link to the preprint version of our findings using the QR code in the top right of the poster. Thanks, and have a great day.